Thank you for joining us tonight. I'm State Representative Christie Carpino from Cromwell and Portland, and I have with me Representative Vincent Candelora, the House Minority Leader, as well from the 86th District. And we have three distinguished physicians. We're going to share some facts and some details about what we need to be aware of with our marijuana and access with our children, how to avoid dangerous situations, and unfortunately, if they occur, what we need to do. The reason we're having this today is in order to really avoid some emergencies and to keep our kids healthy. And with the changes in legislation, we thought it would be a good time to do it now. I will introduce Vin Candelora, and maybe you can help set the stage.
Thank you and good evening. My name is Vincent Candelora. I represent the 86th District. In putting on this event, Representative Carpino, I want to thank our panelists for agreeing to do this. Essentially we had the commercialization of marijuana, the bill passed last year in the legislature, and as it's slowly rolling out into implementation, we believe it's important for parents, especially, to sort of be aware of what the issues are that could be surrounding this effort. Right now, we have many of our surrounding states who have already legalized. And so while Connecticut has some good guardrails put up, which is restricting, the advertising to children, making the products that are purchased in the Connecticut market child-proof, and restricting some of the marketing. There are products out there and will be out there that are forms that could be tempting for children. And not to mention the different delivery models that I just think there is more access now for children to have. Certainly having teenagers in my household, I've seen the evolution and the access that they now have to drugs that weren't even around when I was growing up. And so I want to thank you all for putting this on, and I think it's a good start to try to start educating parents so we could stay ahead of this issue.
Thank you, Van. With us, we have three physicians who share a different perspective on what we're going to be dealing with as a state. Dr. Doyon will be talking a bit from her perspective with the Connecticut poison control. Dr. Brancato is an emergency room physician at Connecticut Children's, and Dr. Carrera practices at Middlesex Health. And each of them will spend some time with us, giving us their perspective. And then if we have some time, I encourage parents to drop questions into the chat function, and we'll answer as many as we can. Dr. Doyon, the floor is yours, ma'am.
Great. So thank you, and thank you for having me. And as was said, I am the medical director at the Connecticut Poison Control Center. So just a couple of words on what that is. So the Poison Center covers the entire state of Connecticut. We are a telephone-based service, 24/7, 365. We are physically located on the UConn Health campus in Farmington, but we answer calls from all over the state, like as I mentioned. The people and my staff who answer the phones are pharmacists and nurses, and they've been specifically trained in poisonings of all kinds, and poisonings that include marijuana, and have years and years, decades of experience, really, when you tabulate all of their years of experience. So they're ready to answer your calls should you have any questions at any point in time. With that, I'm going to dive into a small presentation. I have some graphics that I wanted to share, so hopefully you can see this. Okay, we should go in presentation mode. There we go, in presentation mode. So there are many aspects to marijuana that one can discuss, but the one aspect that particularly affects our young children are the edibles. And marijuana edibles means any confection. It could even be a liquid, really, but any confection, a cookie, a gummy bear, a gummy of any kind, a brownie, would all constitute a marijuana edible. So edibles include all those kinds of things that we can consume by mouth. And so I have here just gummies, because those are the most frequently encountered marijuana edibles, but do remember that they can take any way, any shape or form, really. These are two packaging that I hike a lot, so that I discovered on my hikes in Connecticut, and I want to just show them to you. That's my hand holding them, and these are things that I found on the ground, again, in the state of Connecticut. You see here a zip lock pouch, so to speak. Warheads is a very common candy from our childhood. You see that the colors, the logo, all imitate the true candy, but in fact, these are medicated chewy cubes. They have that logo from California down here, and they're sour, sweet, fruity, chewy candy, whatever. They contain 500, or at least that's what the labeling says, that there is 500 milligrams of THC in that particular packaging. They're under no obligation to have 500 in there. They could have 250, they could have 1,000. This is just what they chose to put on the label, because there's no good manufacturing practices for this. The other one is Stony Patch. You'll remember we have Sour Patch. This is Stony Patch, so a little bit of play on the words. But these gummies are shaped like little teddy bears. And again, they're sour, they're sweet. And this one contains 350 milligrams of THC. THC is tetrahydrocannabinol. It's the active ingredient in marijuana. So 500 milligrams over here, 350 milligrams over here. By the way, if you're marijuana naive and maybe you go to a medical marijuana facility to purchase marijuana for yourself to treat your cancer or your cancer pain, your typical starting dose will be in the order of 2.5 to 5 milligrams. 2.5 to 5 milligrams. That's the typical starting dose for an adult who is naive to THC and just starting, using THC again for chronic pain or something like that, for their cancer or something of that nature. Here is a graph that I produced with the number in 2020. As you know, 2021 is not over yet. So these numbers stop at the end of October. So likely the last point, the one near my arrow, is going to be higher because we have the month of November and December that need to be accounted for. So the slope is likely going to be very similar to the slope between 2019 and 2020. We have a fairly rapid slope, or a fairly rapid uptick of marijuana edibles. So these are the number of exposures. So this is not just someone calling the Poison Center to get information. This is a child under the age of 19 ingested an edible, and the Poison Center was contacted. You see that we have around 2 or 3, I think, in 2018. I think we have about 21 in 2019. And then things start to really, really take off in 2020 with 65, I believe. And I believe 2021 is 69, just shy of 70. But again, that number is going to change. So the slope here is what we're looking at, and the slope is getting acute. What we worry about in children is that little toddler, that little 2-year-old that accidentally or unintentionally gets into the marijuana edible. So if we have about 69 so far in 2021, of those 29, so not quite half, maybe about 45% or so, occur in children under the age of 6. So around 30 or so, so far anyways, in 2021. Most of them are unintentional, completely accidental, and 2 of them we really couldn't zero in on the reason why the child got into the marijuana edible. So the majority of them, the children that did this completely accidentally. And what kind of effects did we see? Many of them had what we call moderate effect, which means they had symptoms, but the point I want you to look at here, major effect. That means the child was admitted to the intensive care unit for a day or 2. The child may have been intubated or placed on BiPAP. Those 3 of those, about 10%, result in an ICU admission, intensive care monitoring for the child for 24 to 48 hours. So I just want to point that out. For those children, it gets to be a very, very serious overdose. So as you know, we have a state law now that is in effect. Now the regulations are still being ironed out, and it is thought that the regulations won't be implemented till 2022. The regulations for the edibles fall under the Department of Consumer Protection, DCP, the Connecticut Department of Consumer Protection. So they are writing the regulations as we speak, but these are the guidelines that are in the law that offer them, again, the guidance to write the regulations. The law itself, I believe, is 350 pages. And the section 32 is what addresses the edibles. I believe that's on page 50 or 51. So if you can get your hands on the law and you want to see what's written about the edibles, go to page 51. And I believe there are about 3 pages on edibles. But to sum up what the law says in sort of plain English, the law will set dose and serving size limits. So, for example, the dose limit will be limited to 5 milligrams. The law asks that they clearly demark what a single serving is. That's the reason. The reason for this is because when a cookie is sold, but it's not clear what the dosing is, what the size of the dose is, people eat the entire cookie. When the intent was one should eat a tenth of a cookie. No one eats a tenth of a cookie. So again, we're going to do away with that deceptive, marketing that some marijuana manufacturers have. And the dosing size is single serving size, going to be clearly demarcated. It has to be easily separable. Again, the whole cookie thing, it needs to be somewhat scored or whatever to make it easy. There needs to be education. There needs to be messaging. Our Department of Child and Families is looking at that, and the injury prevention section of DPH is looking at messaging and education. There are going to be some campaigns about this. There could be no symbols. All the additives need to be listed. There could be no logos. Expiration dates need to be printed on the packaging, and it needs to be white, opaque packaging. It needs to be child-resistant packaging. It prohibits making anything that would appeal to children, and importantly, need to be individually wrapped. So this packaging, not allowed really under the new Connecticut law. The packaging we should see is a white opaque pouch with that kind of double zip lock. That's the child resistant feature. It should have some plain font information outlining the serving size, the THC per serving size, the number of servings in the entire package, and the total amount of THC in the entire package. And importantly, I believe we are the only law in the country that asks that whatever it is, the confections, be individually wrapped. And so that it likely and hopefully will limit pediatric exposures. We hope. It has in other instances when we've used individual packaging, but it's a wait and see. Again, first, we are the only state, I believe, in the country to have individual wrapping as a mandate. So we'll have to wait and see. That all being said, as was mentioned, one can get marijuana edibles by crossing state lines and purchasing the edibles in a different state. One can also get marijuana edibles not on Amazon, but on the dark web. And so we expect some non-Connecticut marijuana edibles to make it onto our markets, and for that to continue to be a problem. And to give you an idea, in states that have passed recreational marijuana laws, for example, Colorado experienced a 3-fold increase in pediatric marijuana exposures in children, little children under the age of 6, after passage of its law. Most alarming, the state of Illinois published data just a month ago. They had a 12-fold increase in children, small children, and marijuana edibles after passage of their recreational marijuana law, I believe in 2019. So we don't know where Connecticut's going to fall. Are we going to be a 3-fold increase? Are we going to be a 12-fold increase? We don't know, but we pretty much anticipate we're going to get an increase in exposures. But we'd like parents to be aware of what to look for, and to know that we worked hard to make a law that makes children as safe as possible. So that's about as much as I have to say. The other panelists will have other stories to tell. Thank you.
Dr. Doyon, thank you. The rapid increase of young children who have accidentally ingested is scary as a parent. Dr. Brancato, this leads us to you. For those who don't know, Dr. Brancato is the medical director of Connecticut Children's Emergency Department. And I wish I could say that I suspected you never saw this, but I would love to hear you explain what you're seeing in real time in the emergency room with our pediatric patients who have had an exposure to marijuana.
Thank you. Thanks for the opportunity to share our experience. As Dr. Doyon said, we certainly have had an increase. I think, looking at the numbers on her chart, it doesn't look like the total numbers are horrible. We are a very busy emergency department. We see over 60,000 patients a year. And if we have 30 of these young patients this year, or 40, it doesn't sound like very many on a monthly basis. But the impact, as she also said, is significant. So I'll share a couple of things as well. We had some overlap in our information, so I won't do the whole talk, but I will show a few highlights. I did want to speak briefly about, I'll show some other forms of these candies. And again, just as a reminder, some of these things, the toaster, these pot tarts have 36 milligrams each. The anti-nausea, medicinal use of THC, as she also said, is about 2.5 to 5 milligrams. The typical use, if somebody is smoking a joint or using some other single dose recreational marijuana, might be in the 20 to 25, 30 milligram range. But each one of these is significant. So in this package of Skittles, each one is 20. The package again is 40. These strips are 100 a piece. There are little ropes and these nerds on the right. It's kind of crazy impressive in terms of creativity, I suppose. But still concerning from an exposure standpoint. One from a couple of medical things. The THC is lipophilic, meaning it passes through the cell membranes quickly. Once it's ingested in whatever form, it disperses into the tissues quickly, crosses the blood-brain barrier. Smoked marijuana or vaporized THC has pretty rapid onset of action, peaking within about 10 minutes, whereas ingested cannabinoids has a delayed presentation. And sometimes that makes it a little bit harder to figure out. And I'll share a story of a patient that I took care of last month shortly, where that certainly had a role to play. And ingested versions, the symptoms will last in some kids up to 24 to 48 hours. The usual expectation is that it will have been metabolized in about 12 hours, but I had a patient who required hospitalization for 2 full days for it to clear her system. With regard to medical presentation, so it's thankfully, mercifully, uncommon still for infants to have any exposure. It's not impossible for an older infant, I suppose, crawling on the floor to find something if there was a candy to be found dropped on the floor inadvertently. Probably the most common age that we see is in the 2 to 3 to 4 year range. These kids are often a little bit safe within a house, so they're able to wander around from room to some degree, and it's not uncommon for them to come across a parent's gummies or even a grandparent's gummies in a nightstand or someplace where they might even forget that they have them. Symptoms, so children younger than 3 will have elevated heart rate, the sinus tachycardia, they'll be drowsy, low respirations and or agitation. The nausea and vomiting is not uncommon. They can also have the reverse. They can have slow heart rate and slow breathing, low blood pressure, and respiratory depression. It thankfully is fairly uncommon to be affected enough to require intubation and be put on a mechanical ventilator, but it does happen. And then a little bit older kids, the majority of symptoms are certainly neurologic. Tremor and ataxia, lethargy, stupor, coma, and occasionally seizures, which may also on occasion be related to co-ingestion, something that's either not typically in the gummy, but in some other kind of substance that's been doctored. Older children and adolescents who ingest or smoke, that's what they're often seeking. And on the one hand, marijuana is often thought to be a relatively safe drug compared to some of the other things that are out there. And nearly daily, we hear on the news about substances altered with fentanyl and the deaths that result from that. So marijuana by itself seems like, well, maybe not a big deal, except it is a big deal, and it can be something that becomes a habit and can raise other concerns. So after Colorado, for example, legalized in the previous decade, a study in a pediatric emergency department found that patients who presented with cannabis use, if they had mental health problems, they had a higher risk of suicidal attempts based in connection with their cannabis use. There's kind of a graphic with some of the physical findings, the redness of the eyes, tachycardia, and hypertension. They can either be breathing fast or slow, hypoventilation, all the various neurologic symptoms, distorted perception, of course, impulse control, a very big challenge in kids who already don't have fully developed frontal lobes and self-control, the flight of ideas, sometimes psychosis and hallucinations as well. So just to briefly share a patient who I had about a month ago, is a 2-year-old roughly, who presented to the emergency department in the evening and was brought in because of acute onset, rapid onset of vomiting and altered mental status. And the child was in the care of another family member, not the parent. And there was thought to be nothing that the patient could have ingested, no known exposures in the household. So it brings to mind a whole host of other concerns. So a young child with an acute change in mental status and vomiting might have a brain tumor, might have a blood vessel that ruptured in the brain. So a lot of other concerns. So the child was clearly altered, required a pretty extensive workup, including a CAT scan of the head and blood work. And ultimately, we did find that it was a cannabinoid ingestion. She was very altered and required hospitalization for 2 days. She did not require ventilation, thankfully. So it's those are the potential serious medical findings and some of the things that we've been seeing. It's not every day, but it is significant. And I think I agree with Dr. Doyon's assessment of the laws, the parameters that were put into place here. I'm hopeful. I think those will be at least somewhat helpful for our children, but it's easy to cross the state line. We're 20 miles away, so thank you.
Thank you very much. I hope you don't see many of these, but trust that you will take good care of those that you do. And our final physician is Dr. Carrera, who's a fellowship trained psychiatrist at Middlesex Health in behavioral health. And Doctor, I saw you shaking your head with some of our panelists, but we'd love to hear your perspective. And perhaps if you could also add what you're seeing and perhaps how parents can really take a close look as to substance abuse and marijuana. Unfortunately, is anecdotally known as a starter. And if you've seen any of that or expect to see anything more as more folks get access.
What did you say at the beginning?
Some parents have asked if marijuana is a starter drug, and I suspect you are the expert based on what you see, if there's anything that you can share based on your practice for parents to be aware of.
Sure. Thank you again for the opportunity. I think, yeah, there's a lot of overlap, right, in what we've discussed today. So I can share what I have seen in my practice in regards to, in some ways, we can look at the presentations that we've heard is what the after effect, and in some ways, I wanted to see and talk about a little bit about what we can do to talk at least with the adolescent population to what does the research say? What is the American Association of Child and Adolescent Psychiatry? What is our stand in regards to marijuana use in the teenage population? And really the main message is preventative, is talking, right? Talking with your child. The main idea being that a child who can at least have that opportunity to be able to talk about or ask questions in regards to marijuana and its negative consequences can lead to a lower chances of doing that trial, right? Because in adolescence, one of the panelists talked about the prefrontal cortex is what is our brake system in our brains, right? And that's what they're developing up until the age of 20, 24, 23. And so that's why you see in teenagers that impulsive sensation-seeking behaviors. And in the adolescent, we are also, this is what I talk to a lot of my parents, we're also developing that identity formation. So therefore, they're more susceptible to what my peers are doing, what are my peers thinking, and therefore doing the either impulsively or trying out either marijuana or the other substances. So what can parents do? Talking with them, and not just talking, but you have to listen. Really just sit down and avoid interrupting. That can be so hard for us as adults. And starting with the question, what do you know about marijuana? As early as late elementary school, early middle school ages, which can be surprising to some, we can start having that conversation and really go over some of the negative consequences of marijuana may bring about, right? At least, what are some of those? Well, I know that there's some overlap, but really it can affect your cognition, level of intelligence long-term if we take it consecutively, if we take it regularly. There are some studies done that showed the lower IQ after you take it regularly in teenagers. Also, talking about that, yes, even though in society might, I don't know, it seems to me like, no, it's not addictive at all. Well, studies have showed that if you try any substance before age 18, you're more likely to meet criteria for an addictive disorder later on in life. Whereas if you wait until after 18, if you may. That's already been shown up. There's been studies that have showed that already. It is not an, it doesn't have, it does affect your concentration, your ability to drive. And studies have showed that when you mix it with alcohol, it worsens the effects of alcohol in driving accidents. And has been linked, marijuana use has been linked to school failure, as well as lower income. And really what I talk with my patients when we have this discussion is a motivation. They're coming to me telling me that, hey, listen, I feel, low mood and I can't get myself out from bed. Okay, so how much marijuana are you really taking? Because yes, that will take your motivation down, and yes, that will pour energy, and that makes sense. Now, Dr. Brancato also mentioned psychosis, and sometimes they come over and tell me about a paranoia. Well, yes, it does make sense. So let's start cutting down. Let's start abstaining to a certain extent to be able to manage these symptoms that you're coming to me for. And so, yes, that is a long discussion, and I went over many things, many negative consequences, but what it comes down to is really listening to your child and not having this conversation once. Also, hey, how is it going at school? And I think part of this too, I like to always connect this. This is not just marijuana, this is not just alcohol, this is video games too, right? Sitting down with your child, because that's another addictive device or whatever you want to call it that is affecting society today. And I'm seeing a lot of depression, anxiety that is secondary to all this. And really it comes down to part of it, because us as parents, we have a lot of influence in sitting down with your child. Hey, what game are you playing? How do you play that? Allow them even to play with you and even lose on purpose. Have them have a kick out of it. And that, so it's setting a precedent of, I am here, I can listen to you. You can come with questions. If I don't know the answer to it, I can go ahead and look for those answers. And really, another question that you had posed is, what are some resources out there? Okay, if you type in ACAP, AACAP, I can even put it in the chat later. Marijuana use, there are they have some resources that you can look up. Also, the National Institute on Drug Abuse, they have a section on adolescent marijuana use. AMSA, I believe, also has a section on resources that you can look up based on, I typed in Middletown, Connecticut, and in our 25-mile radius, we have about 20 centers that treat addiction disorders for child and adolescents. So there are resources out there. I'll put them on the chat just so that, out of the interest of time and convenience, but I just want to leave the message out there that I think a lot of it has to come, yes, parents, yes, school, yes, providers. And I think another aspect of all this is our pediatricians, right? As parents, when you bring your child to the pediatrician, if you have any questions, they're a great source of information as well. So yeah, that's what I wanted to share with all today.
And I appreciate that you said it best when you said prevention is the first step, and I think we can all agree on that. And of course, we need to be engaged with our children at all ages, but I want to just make sure that everybody was very clear in what you said, that marijuana is not safe. And I want to thank you for highlighting the peer-reviewed and well-documented studies that show that there are consequences to marijuana use. And I want to thank you for that, because that is something that I fear could be overlooked. So thank you, Dr. Carrera. I have a couple of questions for all three of you. I've gotten a few texts and a few chat questions, and I'll keep them brief because the three of you were so kind to give us your time tonight. I know we talked a bit about the edibles, and I do think that is very important for people to know what's out there. With some of our older teens, are any of you running into teens who are vaping marijuana, or is that something that you haven't seen yet?
Yes, I think we do. We have for a number of years. You know, the effects are typically shorter and I would say less striking than the edibles in the small children, just because they're physically bigger. So sometimes we see them kind of in the context of other substances as well. Yes.
I agree. That's part of my questionnaire, if you may, when I see my patients. And I think one thing to keep in mind too when having that conversation is that today's marijuana in vape and all these other devices is not your grandma's marijuana, right? It's at a much higher concentration than in the past. So that's something else to take into account in the developing, and its effect on the developing brain.
I think from the standpoint of vaping, we must understand that we really don't even have an FDA-approved vaping product for nicotine, let alone marijuana. And so what really young adults are vaping are non-FDA approved, but the oils and the different kind of additives in there are really not meant to be inhaled into the lungs. And we've run into problems when people made their own little vaping liquid using vitamin E. It's a liquid, and it's an oily liquid, and started to mix nicotine and we think marijuana into these vaping, this vitamin E liquid. The user proceeded to use the vitamin E and develop what we call EVALI, electronic vaping lung injury. I forgot what the acronym stands for. But bottom line, I'm really, really severe lung injury from, again, the deposition, the deposits of vitamin E, again, a very oily substance into the lungs, never ever meant to be in the lungs. So it's a bit of a wild, wild west. I can see why a young adult would turn towards vaping because it doesn't smell nearly as bad as smoking a joint. So you'll be able to sneak it in and your parents won't know you're doing it and this, that, and the other, and you won't get the neighbors upset or God knows what. So I can see the appeal, but I think people have to realize that we have no idea what are in these liquids. They are largely not meant to be put into the lungs, and they will cause lung injury. We have evidence. It happened a couple of years ago, and it's going to happen again for sure.
Thank you. And I know we hope it doesn't happen, but what are the long-term health implications for these accidental ingestions? I know that you treat them very well in the emergency rooms, but are you seeing some long-term treatment or additional treatment needed after the acute care?
Well, thankfully, as Dr. Doyon was saying, there was a little rush of them a couple of years ago when the vaping first became a thing. Not many, 2 or 3 years ago, and it has faded somewhat. That doesn't mean that kids aren't vaping, but they're doing it a little bit less, maybe. And I think there's a little bit of awareness of some of the risks involved. But there's the ability, as she also said, the ability to hide it. Is one of the big attractions, I think, for adolescents. I wanted to add one other thing about marijuana in general. There's, and this is not age restricted, but there's almost never a day. I don't live right here in the middle of Hartford, but I work here. I live in an adjacent town. There's almost never a day in decent weather where I am walking, biking, driving, sometimes if my window's cracked, when I do not smell the smell of marijuana coming from another vehicle. And it's not only in Hartford. And so just so that we're clear, it's not just an inner city thing. People are smoking while driving on a regular basis.
And this problem has no borders. So thank you for bringing that up. This impacts all of our communities, which is why Representative Candelora and I thought it was important to have this discussion, because it impacts all of our communities, whether we realize it or not. I know particularly, I too have noticed the smell outside over the warm months, particularly this year. I don't know if I was perhaps more aware after the legislative changes, or if the uptick has truly already begun. How early is too early to start talking to our young kids about marijuana, knowing that access has increased?
Yeah, I mean, like I had mentioned before, towards the end of elementary school, mid-elementary school, early middle school. I mean, I think that goes, that I very little that I would say that I can find out that would go against that, because we know that they're doing it as early as middle school. It's just the vape pen. So that's what I had read, and I that's what I've been telling my parents. I don't know if any of the other panelists have anything else to say.
I think there's benefit to, like you mentioned, the role of pediatrician, as there's more awareness in the pediatric community and in the public in general. People will be doing this. Parents will sometimes have gummies that they use for themselves, and a large percentage of the small kids anyways that we see they are accidental things. They're from parents or grandparents not being safe, not storing things carefully. There's a certain awareness to keep, the liquor up in the liquor cabinet, but the gummies may be in the bedside, nightstand. So,
yeah, as a parent, I wanted to add to that point. About 8 years ago, we started to see the introduction and proliferation of the vaping of nicotine, and it was my 11-year-old son who, we were going into a restaurant and identified the smell of a vape, and he said, "Oh, somebody just vaped," and I had no idea what he was talking about. And he said to me, "Don't you smell the watermelon flavor?" And I was taken aback by that as a parent, and it made me realize how much access our kids have to information, even just through the social media that they're on, that they are much more educated on what is sort of in and hip and is being utilized than us as adults sometimes would have. And so I certainly do agree with that the conversations are so important. And the different delivery models of marijuana has made it a game changer. I think we're seeing it more in schools, because that's where you're going to want to vape marijuana, because it's not detectable. And so you could do it right under the nose of a teacher. And so having those conversations with our kids, you find out so much information. And so I just thank you for that and for providing all this information, because the only way we are going to get in front of this is making sure that the generation our ages really understand what this product is now, and how much it has changed and evolved over the years. And with the new commercialization elements, that it's not just a joint anymore. It's about every product under the sun that can look like marijuana.
Thank you. I will put one last reminder out there for questions, and while we're giving our guests a last reminder, I will ask each of you physicians if there's any other closing remarks you want to add. And Dr. Doyon, I will ask you to share the poison control number. If you don't mind, I was waiting, but I thought it would be appropriate if you don't mind sharing that. I think every parent probably has it, but it's probably a good reminder while you're doing your closing remarks.
So thank you. I'll start now, I'll end with the phone number. So it's 1-800-222-1222. 1-800-222-1222. 24/7, 365. I'd like to echo, but also elaborate and take it even perhaps a step further. If we are concerned about young children getting into edibles, then we must understand that edibles is just like any other drug, just like any other medication in the household. It must be stored in a child-resistant packaging. It must be stored away from children. And just like even with vitamins, but just like with any other medication, we are asking parents to not ingest it in front of the child and not say something like, oh, this is mommy's little gummy that helps her sleep. Don't use that language. Don't do it in front of the child. Many times the story we get at the Poison Center is a little 4-year-old said, I took the gummies that you take, mommy, because you take them, so I decided I should take them, or a variation of that scenario. Children imitate their parents. And so we must be very, very careful as parents to model the correct behavior. And I would urge parents to not take the edibles or their marijuana product in front of their young children, because they will imitate you. For older children, middle school, high school, be aware of, yes, the marijuana joint, but be aware of the vaping, be aware of the edibles. The edibles look like candy. They can eat it at lunchtime in the cafeteria on the school premises. No one would know the difference. Look at the packaging from a distance. There's no way anybody can tell the difference. And then within an hour or two, they're high on marijuana and they're in their math class or whatever. And they can do this readily. So just be aware of how the edibles can masquerade and be deceptive in the masquerade. Again, I'm going to finish with the phone number, 1-800-222-1222. Again, if you have a child or anybody gotten marijuana, call the Poison Center. We'll be happy to help you.
I don't have anything in particular else except to ask parents to have a low threshold for concern. So while the patient that I described earlier was quite seriously affected, many children who have ingestions may have kind of subtle things. They may be unusually sleepy or a little bit unsteady, or have a minor slurredness to their speech, something like that, depending on how much or what they got into and their age and size. And if they took a tiny bit and have mild symptoms, that may not be a problem this time, but it certainly might be a bigger problem another time.
Yes. I really, another couple of other things, right? If you see that the eyes are bloodshot red when they come back from school or throughout the day, or wait a minute, why is Johnny getting up in the middle of the night to eat every day? Or what happened to the money, right? The money missing or stealing money. Wait, are you hanging out with different kind of friends than usual? Or you're more irritable than usual, isolating more so than usual. To be on the lookout for these types of changes that doesn't necessarily mean that it has to be marijuana, but there could be a mental health issue, that could be depression, anxiety, and that, just to be, and really not to belabor the point, but really just ask. Talk to your child, really, because you just won't know unless you ask.
Thank you all. You've done a tremendous job. You've highlighted that prevention is our best first step. The seriousness of access to marijuana, particularly for our young folks, and you've given parents tools in what to look for, and in an unfortunate situation, what to do if there is an ingestion or you need treatment for suspected abuse. Our kids know more than we think they do. I have two who are loitering not too far from the door now. I'm sure I could ask them some of these questions. But you've really provided an important service. So a sincere thank you as both a parent and a policymaker to the three of you for giving us the resources and the chats, and for what each of you do on a day-to-day basis, particularly over the last 18 months. Thank you. Have a wonderful night. Vincent Candelora, thank you for being my co-host, and thank you for always being a strong advocate on this issue, sir. Good night, everybody.